Welcome to the pre-Nationwide Drill webinar today. Today's webinar will cover all of the required skills and tasks that you'll need to know how to do in order to be successful in the Nationwide Drill that starts on Monday, August 21st. I am joined by Lauren Finkley. If you would like to introduce yourself.
My name is Lauren Finkley. Currently, I'm the acting team lead for the Technical Assistance and Guidance team at CDC for the Division of State and Local Readiness and the developer of Simpler.
So you'll be hearing from both of us today to talk about RadResponder related activities as well as CRC Simpler tool activities. So before we talk about the various skills that you'll need, the Nationwide Drill itself is going to highlight the enhancements made to the population monitoring module in RadResponder by using the Community Reception Center Simulation Program for Leveraging and Evaluating Resources, or CRC Simpler. This tool is going to generate data, which you are then going to associate with your RadResponder events and community reception centers. For this drill, you do not need to set up any CRCs or use any equipment. This is all going to be done online using both RadResponder and the CRC Simpler tool. We'll just dive right in with various RadResponder skills you'll need for the Nationwide Drill. The specifics of what you'll need to do for the drill itself will be outlined in the drill instruction materials that will be sent out next Friday. But these are going to be the high-level skills that you'll need to know. And if you have any questions, you have between now and the start of the drill to ask them or become more familiar with the various capability. The 4 skills that we'll be going over today. One is ensuring that your organization has the population monitoring module enabled. Then we'll talk about creating an event and making sure that the event itself has population monitoring. We'll then talk about how to create an ad hoc event facility, or your CRCs. And then we'll talk about the actual data entry for populations for people, animals, and vehicles. In order to participate in this drill, you do have to have the population monitoring module enabled at the organization level. You can easily check this by going into your organization details page and opening up the organization settings section. This is going to tell you the various hazard types your organization has enabled, and you'll see that there is population monitoring module enabled. If it says yes, you're good to go. If it says no, we need to enable that for you. If you do not have it enabled, you can email us at support@cburnresponder.net and we'll make sure to enable it for you before the start of the drill. Once your organization has the population monitoring module enabled, you will see that there is an option to turn that population monitoring feature on for an event. So if you go into create an event and you go to the event settings, you'll see an additional checkbox, which we have outlined in orange here, that says supports population monitoring. If you do choose to add partners on your event for this drill, but their organization does not have the population monitoring module enabled, those responders will not be able to view or enter population data, even though they will be on the event. So just make sure that everyone in your organization or your partners that are going to be participating have population monitoring enabled, and you'll be all set to go. So now we'll talk about actually creating an event and enabling that population monitoring module. You must have the event creator role, planner, or admin privileges to create an event. While you can create an event from the mobile application, we recommend that you just do everything from the website for this drill. So there are 2 ways you can create an event, either one from the website homepage, we have that green events tile, or from the top ribbon under the event section, you can click that drop down and select create an event. Either way, you'll be brought to this event creation form and you'll be given your various required fields. For the required fields that we do not explicitly state, or even the optional fields that we do not explicitly give you in the drill instructions, this is your opportunity to use whatever you would use in a real incident, whatever your common operating picture or standard operating picture dictates. So for sponsor, you would just put your organization. For name, we have a suggested naming convention, which again will be outlined in the drill guidance materials. So for example, you can just have your organization's name and then RadResponder PopMon Drill 2023. You can name it something else if you have your own naming conventions. You'll just need to let us know what the name of that event is. For start date and end date, You can pick whichever dates you'd like. Hazard type, you'll choose radiological. And then for type, we recommend that you choose exercise or drill. You can pick another one if that's what you would like to do, but please do not select emergency response or non-emergency operation. For sharing mode, this is going to determine which other organizations, if any, are going to be added to your event, or if you're going to be working as an individual organization. So the 4 sharing modes that you have are My Organization Only, Network-wide, Partners Only, and Private. My Organization Only is going to just add you and all members of the sponsoring organization to the list of event responders. Network-wide, this is the sharing mode that's going to open up your event to every single person who has a CBRN responder account. We highly recommend against doing this. Next, you have Partners Only, and this is going to add all members of your organization that's sponsoring the event, as well as any of your standing partners that you've set up at the organization level to share your events with. But as a reminder, unless your partners have the population monitoring module enabled, they won't be able to see any of that data. And last but not least is private, and this is going to be a sharing mode that if you select it, only you are going to have access to it. No one else in your organization will have access unless you explicitly grant them access. So we recommend either choosing My Organization Only or Partners Only as your sharing mode options. After you select your sharing mode, you can then choose a scenario. This is an optional field, so you don't have to, but if you do select one, we recommend using the scenario of public contamination or exposure. You'll scroll down and you'll have a couple checkboxes. Definitely make sure that your event is marked as active. And then for the release point location entry mode, we will give you a suggested location. You can select from map, enter a manual lat long, an address. And then you'll be brought to the event settings section. Here you can toggle or check on and off the various features that you want your event to support. And this is where the supports population monitoring checkbox is going to be selected. If you do not see this option, this means that you do not have population monitoring enabled. So another thing that you need to do is check this and email us if you do not have it. Once all looks good, you'll save your event and your event will be created. So next we'll talk about creating an ad hoc event facility. So we are not going to be using any of your real CRCs or real organization facilities for this drill because we do want this to be in an exercise environment. When you create your event, you'll go directly to the facilities page by expanding the configuration tab on the left-hand side of the event homepage and selecting facilities. This will bring you to the facilities event page, and if you have the proper permissions, which if you created the event you will, you'll see a green Add Facility button. You'll click that, and you'll be brought to the Add Facility page, and you have 2 options. You can either create a new facility or select from an existing one, and you are going to be creating a new facility. You'll fill in the general information, so the name that you want your facility to be, any descriptions if you have any, and for type, you must select Community Reception Center. If you do not select the CRC type for your facility, then you will not be allowed to associate population data with that facility. You'll then choose the location. You'll be brought to the event-specific details section. Make sure your facility is marked as being open. You don't have to select a go live date. You can if you want, but again, we just want to make sure that your facility is open so that way it can receive data. You can add contacts or POCs if you would like, but it's not required. After you enter the basic facility information, you'll then be brought with the Community Reception Center specific details section. So this is where it's going to be a little bit more lengthy of a process than it would have been before these enhancements. But once you go through it once when you're creating the facility, you don't have to do it for each subsequent data entry when you're entering population data to associate with that CRC. So the first section is general information, and you'll fill out any of the fields that are not required or are required. It's really up to you and how much information you want your CRC to have. So you'll choose a date open, your estimated throughput per hour, and you can designate a main point of contact that has a RadResponder account. Then you'll be presented with a couple options. You can check whether decontamination is available, whether or not animals are accepted or vehicles are accepted. If you do select animals or vehicles, you'll be presented with additional fields about those specific types. You will be given instructions on if your CRC accepts vehicles and or animals or not for your drill guidance materials. After you select those details, you'll then be brought to your resources section. So this is also going to be something that, I don't want you just to make up numbers. Definitely think about them and how many you would realistically be able to access and have. You'll select add resources and you can add detectors, portal monitors, showers, and staff. You'll select the green add button next to the individual resource, and then you'll add the quantity. I'll scroll down, and now I'm getting into the contamination screening criteria for people, animals, and or vehicles, again, if they are selected or not. It is required that you enter contamination criteria for people with external contamination, animals with external contamination if animals are accepted, and vehicles with fixed contamination if vehicles are accepted. This is because when we are tracking the population that comes through and we ask how many people had external contamination, we need to know what that threshold is. The description for people with external contamination is the minimum reading for which a person should be identified as having external contamination. You can add additional screening criteria if you would like to define that. You don't have to, but you can. If you want to, you'll select the blue add criteria for people, and you can add people sent and referred to hospitals, people with internal contamination, people with signs of ARS, and you can identify a value in unit for those. You'll do the same for animals and vehicles in terms of the external contamination, and then you'll be brought to the screening characteristics. So these are the different types of people that we are tracking. So by default, if you've used this capability in the past, you'll know that for people, we tracked pregnant and younger than 18. They're still going to be the default characteristics. So if those are the ones that you like to track, you don't really have a need to track anything else, then you can just leave the module as is. But if you wanted to add additional screening characteristics, you can. You'll see that there is a green add characteristics for people option. And here you can either remove the default ones that were selected, so pregnant and younger than 18, and you can add additional characteristics. So access or functional needs, recently received cancer treatment, nuclear medicine, or radiation therapy, stomas or open wounds within a mile radius of the incident. These are the new characteristics that we have made available with the recent population monitoring enhancements. We do have a potential to expand this list, but as of right now, this is just the list we're working with, so we're definitely looking forward to hearing your feedback and what you all typically track for your CRCs. For animals and vehicles, these are the characteristics we track: household pets and service animals. And for vehicles, either city public vehicle, emergency response vehicle, or private vehicle. You can remove these, so if it doesn't matter to you whether it's a household pet or service animal, you can remove them and just track animals, and same with vehicles. So we really recommend that when you go through this, you think about what you would realistically be tracking and apply that to the CRCs that you create. You'll scroll down and you have another contact section. So if you haven't entered the contacts previously, you have another opportunity to do so. You don't have to do this for this drill since it's not a real CRC, but just know this is an option for you in the future. And last but not least, the last section is going to be identifying the hours of operation. By default, they are listed as Monday through Friday, 8 a.m. to 5 p.m. You can change these. It doesn't impact how you're entering your data, but if you wanted to have the hours of operation set, you could do so. And finally, once you're done scrolling through this long list, you can save and your CRC will be created and added. The last RadResponder skill you're going to need is to actually enter the population data for people, animals, and vehicles. When you are ready to enter that population data, which you are going to receive most of the data from the CRC Simpler tool, you must do so via the website. So I mentioned earlier that for this drill, I recommend only using the website, and this has to be the case when you're entering data since we do not allow for population data entry on the mobile application right now. There are two different ways you can enter data from the web. You can, from your event space, expand the data section and select population data, or you can select the Submit Data tab on the left-hand side and select the population data icon. Either way, it's going to bring you to the Create Screen Population Record page, and you are going to then enter the aggregate data for the specific time period or shift. You'll select the organization that you're affiliated with. You'll then select the facility that this data set applies to. So if you have multiple CRCs on your event, you'll need to choose which one you're recording data for. And then the start and end date. These are going to be the shifts that we give you. So for this drill, you'll either enter a 4-hour time period or an 8-hour time period. Once you enter those details, you'll scroll down and you'll be brought to the data section for people. You'll be presented with the contamination criteria that you set at the time of facility creation. You can edit this if you would like, so you can remove any superfluous contamination criteria. You can add additional ones. If the way you set it up at the time of creating the facility is the way you want to proceed, you don't need to touch these at all. And you can also edit if you need to. Same with characteristics. You can remove characteristics or add them. But again, if you set it up the way you would like at the time of creation, you don't have to worry about editing anything. You'll be brought then to the screen population details for people, and this is where you're going to be entering the aggregate information. At the top, you'll enter the total number of people screened during that designated time range, so that shift. Then you're brought to the various criteria section. So we have external contamination, internal contamination, sent or referred to hospitals, people with signs of ARS, people sent to shelter. So for people with external contamination, you're then going to enter the total number of people that have an external contamination of 100 CPM, not relative to background. This is regardless of their characteristics. Based on what you select, you can then track the number of pregnant people with external contamination and people younger than 18 with external contamination. You'll continue this pattern for the various categories and population characteristics as you go down. In order to make the data entry process a little bit easier and more clear, whatever you set for your contamination criteria, it's going to be in the text of the description. For example, we have people with external contamination as 7 microR per hour relative to background. Then, in the defined contamination criteria, the value and unit will be in the description when entering the records. So you don't have to worry about scrolling up and down, going back and forth between pages. It will say people with external contamination, the number of people who are identified to have detectable external contamination of 7 microR per hour relative to background. The same is going to work for animals and vehicles. You'll be presented with the contamination criteria and the ability to edit it if you would like, and same with the characteristics. You'll then enter the aggregate information, so the total number of animals screened. The next section is external contamination, so animals with a detectable external contamination of 100 CPM not relative to background. So you have that in the description, and then you'll enter the total, the number of household pets and service animals, and you'll continue that pattern. And last but not least, if your CRC accepts vehicles, you'll be brought to the vehicle section. You'll have the same thing, the contamination criteria and characteristics with the ability to edit them. You'll then enter the total number of vehicles screened, those with fixed contamination, and then the individual characteristics and the breakdown of those vehicles that had fixed contamination. You'll continue this pattern and you'll save your record. So the biggest work or lift for this drill is going to really be creating the CRC and setting it up properly. The actual data entry is going to be rather quick. You will be getting those outputs from the CRC Simpler tool, which that will also probably take a good amount of time, but the actual data entry process in RadResponder is going to be very quick. I will show you how you can actually view the data that you've entered, because you may be entering multiple shifts or data for multiple shifts in one CRC. To view the population data, you can navigate to the population data screen. So you'll expand data depending on if you have a multi-hazard event, you may need to expand radiological and then population data. And you'll be brought to the population data for community reception centers page. This page is going to list all of the community reception centers that have population data associated with them. So for this event, I have 2. You'll then see an overview of the total number of people screened, the total number of animals screened, and the total number of vehicles screened. This is a cleaned up view of what previously existed. So you're going to have a couple more clicks in order to view the greater details, but it's going to make these tables a lot clearer and easier to read. So if you want more information about the total number of people screened at this one CRC, you'll click that number and you'll get the breakdown. So there were 50 people screened, 23 had external contamination, 2 had signs of ARS, etc. If you want to view the characteristics for each of those, you can expand it. So here we have people with external contamination were 8. If I were to expand this, I then have the individual breakdown of all the characteristics that I'm tracking. If I want to view the individual population records associated with the CRC instead of just the total amount of data for that CRC, I'll click this magnifying glass icon. And now I'm brought to the CRCs page and all of the population record details associated with that one CRC. If I scroll down, I'll see that there are 2 records associated with this CRC. I can select any of these numbers for the total number of people and animals, vehicles for a breakdown. So very similar to what we saw earlier, except this is going to be per shift. So if I wanted to know the breakdown of the 1,364 people screened during this 2-day shift, I can open this and I'll have the same interface that we did previously. And if I want to have an even more granular view, I'll click into the shift details itself. So this is going to be the details of one single data entry. I'll see the time range, so the 2 days here, but again for the drill you'll have a shift of 4 hours or 8 hours. And then I have the details of information just from this shift, and I can scroll down and it will be very similar to how it was formatted for the data entry portion. So here's an example of what this looks like in action. So I can click on the total people screened at that full CRC. Now I'm in that CRC specific details page and I can see all the shifts. I can open up an individual shift to see the most granular data. I'll see all the details about people, animals, vehicles, and their corresponding contamination criteria and characteristics. When you do receive the drill guidance and materials, we will have job aids linked throughout. We also will have an appendix to the drill, which will give you a step-by-step, screenshot-by-screenshot instruction of how you can enter your data in RadResponder. So for an example, this is a screenshot from the drill guidance materials itself that you will receive on next Friday. And it says, for additional guidance on creating events, refer to the job aid here, which will link you to the RadResponder resource library folder, and then the document reference number. So if you wanted more information on how to create your event, edit, manage your event, you'll get this full comprehensive job aid, and you'll be able to, again, follow those instructions. So that was the RadResponder side of things. I'm now going to hand it over to Lauren to talk about the CRC Simpler skills needed for the nationwide drill.
CRC Simpler is a planning tool that was developed to help radiation emergency planners understand their current capacity, seeing potential bottlenecks, and identify any additional resource needs when planning for population monitoring during response to radiation emergency. And ideally, you would develop or revise your CRC plans, you would run estimates using CRC Simpler, identify any changes that need to be made, and then go back to your CRC plans. And we see this as an iterative process. So Simpler, which Christine said earlier is a simulation program for leveraging and evaluating resources, is a free online planning tool that allows for resource and throughput calculations for routine or emergency public health activities such as population monitoring. It leverages real exercise data, times we've collected from across the country from different community reception center exercises. For portal monitors alone, we have over 2,000 times we've collected. We've done a lot of user testing to ensure that it's easy to use by cross-sector personnel, and it is highly dependent on graphical outputs. So one comment that we got from previous modeling software was we don't really want to do a lot of reading. I can't find the data that I need, so we've done a lot of work to make sure you have what you need to make decisions quickly. And it's flexible and scalable, so you can always adjust based on your capabilities. We're always adding new stations. You can always reach out to us, and then we also update the model as times are collected. So there's a couple different ways that you can use Simpler. One is planning and training, so you can look at your current plans. So what's the maximum number of people you could process given your current resources? Another example is exercises. So you do an exercise and then you can compare your exercise throughput to Simpler estimates, seeing how well you did. If you were slower than Simpler, maybe there's some different training that could be done. If you were significantly faster, maybe there's a very different way you're approaching the process. And then during an emergency, if you were going to request additional resources, what additional things would you need to process everyone in that desired time frame? So this is CRC Simpler, and the web link is up here, and we will also have it in the instructions that Christine will be sharing. And so there are a couple different tabs up at the top. So more home, this is the main tool about CRC Simpler. This is information about how we developed it, a little bit more about how it should be used. We have some CRC resources, mostly the population monitoring guide for reference. And then for training, we have our quick start guide, our user manual, and then scenario walkthroughs, and those are pretty thorough if you wanted to walk through the use of a whole scenario. So going back to that home tab, you have some sub-tabs, and there's the original tab you start with, and then the rest are output tabs or optimization. So we're going to work from left to right in this demo. And some really great things about Simpler are if you didn't feel like reading the user manual or you weren't attending a webinar, we actually have a click-through tutorial on the top of each of our pages. And so you can always click through that, and it actually steps you through how to use the tool or how to use the data on the output tabs. We also have that quick start guide as a quick reference on the tab, and we have tooltips embedded throughout. So we have hover tooltips. Those are quick tips. And then we also have these question marks that pop up with a lot more additional data. So with that, I'm going to run a demo and then show you how you would enter that data into RadResponder. So for today and for the drill, we'll be using CRC station setup number 1. Simpler does have a much more complicated station setup, but we're working on building that feature out. So I would use number 1 for this webinar and exercise. And this shows you the flow of how people would be processed through the community reception center, as well as the stations that will be used. Next, we choose a registration method. So there's default, which is kind of an aggregation of everything, short electronic, and priority electronic. For today, I'll do default. And then decontamination method, right now we have shower. We're working on adding sinks and dry decon. Our next section is information about the population, so how many people you expect to arrive at your community reception center based off of the incident or based off of census data. You might be able to predict that. So today we're going to go very big. You can choose whichever you want. And then we are going to say that we have 10% of the population contaminated. And when looking at percent contaminated, that means based off whatever criteria you set. So if it was 300 counts per minute, if it was 1,000 counts per minute, it doesn't matter. We expect that based off that criteria, 10% of the population is contaminated. That's how that would be used. Next, we're not going to have any pre-registration. People are just going to show up to our CRC. We'll have 25% of our population needing assistance, and that would include access functional needs, as well as anyone that just needs additional time or instruction. We won't have any medical evaluation needs for today, and then you have the arrival distribution. So there's uniform for this 10,000 case. That means a steady state over our shift. Other options could be bus loads, so huge chunks of people coming in waves, or front loaded, which would be a line when you open your community reception center. And then we'll do 12 hours per day. Other options, depending on what you've selected, may include 4 or 8. So something to be mindful of with Simpler, there's this cascading query happening here. And what that means is what I've selected up top is directly affecting everything I can select at the bottom here. So you might find you have more options by changing something at the top and then adjusting. And lastly, I'm going to set the number of resources I'm using at my CRC. So you might start with what you entered into RadResponder. So here I have 4 portal monitors set up, 2 pre-decon handheld screening detectors, 4 decontamination showers, that's what would be used here, 2 handheld detectors after decontamination, and then 60 registration desks. So there's multiple options here. And then let's say I actually want to assign 2 staff per registration desk. So you can go to assign staff, and then you would go to registration, which is right here, and I would say 2 per 1 lane. Now it's updated that staffing. Staffing doesn't really change the time to process people in Simpler currently, and that's based off of the data we've collected in the field. We haven't seen significant changes when you assign more staff to help one person. But sometimes people want to account for staffing and their numbers, so we have that here. So with that, I'm going to hit estimate. And now you'll notice that it's automatically gone to the summary output tab. So here we have our summary output. So this is at the end of that 12 hours, what have we accomplished? So over that 12 hours, we had an hourly throughput of 488 people. We've only processed 5,855 people in that 12 hours. So that means we have a bunch of people we still need to do. We have our average time spent at the CRC. So think of that as how long someone's there, and the longer it is, the more antsy they'll be. And extended open hours, that's your overtime. But this is the key number for the RadResponder exercise, is that total throughput per your shift. And if you ever forget what you entered as your inputs, it's in the top right corner. And then you can see station breakdowns down here for wait time per station, utilization or busyness, and then the line length. And these, the question marks, will tell you how to use the data if you were unsure of what to do with it. And another nice thing about Simpler is that you could actually export this page as a PDF, and then later you could export it as a CSV file if you wanted to do your own data visualization. So here we have our total throughput, and something else to look at, we have hourly throughput. So if I wanted to know how many people I processed that were contaminated, then I would go to decontamination throughput, and we can see that at 12 hours, we processed 491 people. And this line here signifies the end of your shift for the end of your open hours. And you can just hover and see the number, or you can go down here where there's a table. Again, there's that click-through tutorial that'll help you through how to use this tab. And then if you wanted everything in a table, it's on that Output Tables tab. So here it is. So that's the first sections of using Simpler. The last thing I'm going to show is the optimization tab. So the optimization tab is, you know, I put in my data, I put in my resources, and I'm not getting the throughput I want. So what is it that I need to get everybody through? And we designed this to be helpful and not super prescriptive in saying this is your only option, so it gives you a couple options. So when you're entering your CRC constraints here, you'll say, you know, actually, I think I could get 2 more portal monitors from either neighboring jurisdictions or asking from the state. I think I could get several more volunteers for registration. So I'll say up to 100. And then other things you could do, which might limit your options, would be changing the most you want them to time you want to spend at the CRC, how long you want them to wait at each station, or the maximum line length. But we're going to leave those blank for right now. So you've said these are the most resources I can get. So I'm going to hit estimate. And then you'll note that this top area here was your original throughput estimate, and then the next three options here under optimal options provides the top three options based off of what you gave. So here it shows additional resources. So with 2 additional portal monitors and that 40 staff, you get 9,384 people through. If you were only able to, for this bottom example, get 1 portal monitor and 30 additional registration staff, you'd get about 8,000 people through. So it gives a couple options. Let's say that I can get all of those staff and resources, so I can select add to comparison. And now you can see our original processing for total throughput and our updated one. And the darker color is the comparison, and you can also visualize it here on the graphs. So that's how you use Simpler to get your base level throughput numbers. And then I'm going to pull up a cheat sheet that we created to help get the data from Simpler into the RadResponder model. So we have our Simpler output. This is what I just showed with that 5,855. And that number is key, and that's your total people screened. So when Christine was showing the population total people screened, that's the number that you would enter. Next, if you're thinking of your external contamination number, that's where we would navigate to the hourly output tab for decontamination throughput, and we showed at the 12-hour or whatever your shift hour is mark, we would do 491. So that would be the number we enter into external contamination. And then for internal contamination, here's where we'll do a little math. You would do 10% of that population. So most subject matter experts would anticipate less than 10% of persons who are externally contaminated to be internally contaminated. So that's the number we suggest using. You're welcome to change it if you wanted to go bigger or smaller. Next, we have people with external and internal contamination for access and functional needs. So if we remember, that number I had for needing assistance was 25%. So you would multiply your totals in each area by 25%. And you could always change that again, up to you. The national average for people with disabilities is 27%. So if you know your jurisdiction has a different population percentage, then you could add that. Now for animals screened, you multiply that total throughput number by 37% to get your total animal screened. And that is a number for knowing that out of households having pets and how many pets per household, and this is based on census data. And then applying through, you take your people with external contamination, multiplying it by that same amount. To get your animals with external contamination, we'll assume that the animals are contaminated with their owners. And then you can save and submit data. So you complete the data entry, like Christine said, by clicking at the bottom of the page or also at the top of the page to hit save. And then if you wanted to view it on a map, you can also view it in RadResponder on the map, and then you'll see the little icon and you can click it and it pulls up that same data that Christine was showing you.
That cheat sheet will be available to you all. We'll link it in the actual drill guidance materials, so you will have all of this at your disposal. And we'll talk a bit about the actual drill itself and the materials you'll receive and what the next 2 weeks are going to look like. So in the late afternoon next Friday, all drill registrants will receive the drill guidance materials via email. And only those that are registered via the GoToWebinar link will receive this email. So if you're unsure if you're registered, I recommend you go to the RadResponder homepage. Under the upcoming events section, you'll see that there is a link for the drill execution and closing webinar. And the register here, that's the link that you need. You all right now are on the pre-drill webinar, so you're good there, but we do need to make sure you're on the execution and closing webinar registration list in order to receive the materials. You'll receive 2 documents. You'll receive a Word document. It has all of the instructions, the drill objectives, the various roles that you need, the scenario, and then we have various sections. So we'll have, how to set up your CRC, the various shifts, and the inputs. The second document that you will receive is a drill feedback PDF, which I'll show you in a little bit. All of these materials are going to be available in the resource library. So that folder is linked in the upcoming events section. We're going to have all of the job aids that you would need to be successful. We'll have that CRC Simpler cheat sheet. We'll have the pre-drill webinar slides, the one-pager. We'll have everything you need in that resource library folder. In order to be counted as being a participant of the drill, you are going to need to fill out this participation and feedback document. This is that second document that will be sent to you. Basically, you just need to let us know your name, your organization, what you named your RadResponder event, and the number of participating personnel. So if it was just you would just write 1. We then have breakdown sections for feedback and suggestions. So this can be anything from the way it was implemented in the drill to the feature itself. You can also ask questions here if you need to. So these are going to be things that you've gleaned from after completing the drill and reflect on your experience. We would love it if you could provide us with population monitoring, enhancements, feedback, and suggestions. Any general RadResponder feedback, again, this could be drill related, just RadResponder in general. And then we do have an option for CRC Simpler feedback and suggestions as well, which we'll share with Lauren and her team. We'll have you email that to us by Monday, August 28th. The drill, again, is officially open from August 21st through 25th. The closing webinar on Hot Wash is on August 25th, so that is 2 Fridays from now. And here are the schedule of events. So the pre-nationwide drill webinar is happening today, which you all are on. By Monday, August 14th, a copy of the pre-drill webinar slides and the recording will be posted to the resource library, our YouTube page, social media, and we will email you the link. Then next Friday, in the late afternoon, you'll be sent all nationwide drill materials to those who are registered. Then on Monday, August 21st, that is the official start. From August 21st through 25th, we have on-demand live support. So if you have any questions, this is where we'll be able to help you out. And then on the 25th is our closing webinar and Hot Wash. And last but not least, on August 28th, we'll have you send that feedback and participation document back to us. So again, we can count you and your organization as being a participant. Email us if you do not have the population monitoring module enabled, and we'll enable it for you, or if you have any questions between now and the start of the drill. The drill itself is meant to really show you the various tools and resources that you can use for community reception centers and population monitoring, which is why we're using both CRC Simpler and the RadResponder tool in conjunction with one another. The drill materials that you will be sent provide some basic inputs and guidance, but anything not explicitly stated, this is going to be up to you and your organization. We want to give you the flexibility to make this drill as customizable as possible for you and your organization. So if you need to tweak some things, like Lauren said, if you need to adjust the various population percentages, you can do that. This is meant to be a learning tool and an exercise. We will send out all the materials to you next Friday. And if you have any questions in the meantime, you can email support. And if you have a specific question for Lauren, you can still email support and I'll forward it to her.